Hi, everyone. It's Jessica Hutchins and Dr. Dan Knightis here at Inspire Wellness doing our first Facebook Live.
Hi, everybody, and thank you so much for joining us. We're absolutely thrilled to be here. We wanted to start by introducing ourselves and tell you who we are. So as you know, I'm Dr. Dan Knightis, and I've been practicing family medicine for 22 years. About 5 years ago, I was brought over to the Cleveland Clinic Wellness Institute as the Chief Operating Officer, and I stayed there for 5 years before starting Inspire Wellness with Dr. Jessica Hutchins. And we both decided to pursue this independent practice because we want to be able to spend time with our patients as we learn their history and try to figure out what exactly is going on inside their bodies, which may be disrupting them from living at their highest quality of life. And so this is a great opportunity for us to spend the time with our patients to be able to partner with them and potentially get them on the right path. So again, thank you so much for this opportunity and for the opportunity to serve you, our patients, within the community as well.
So hi, I'm Jessica Hutchins again, and I'm one of the handful of people in this country that are board certified in OBGYN and certified from the Institute of Functional Medicine. So bringing those two things together, it's really allowed me to have a lot of insight into how to treat chronic disease. And autism is a chronic disease that is just as treatable as any other chronic disease. We also both have autism specialty certificates from the Integrative Medicine Academy too that really helped us try to figure out how to treat this specific set of symptoms. So we wanted to just make you aware this is our first Facebook Live for Inspire Wellness, and we're planning on doing a ton more. So if you have any suggestions on ideas, please send them to us. We're very open to anything that our audience is wanting to hear about. So let's start with just a few basic ideas. One is there's a big sense now about how autism is genetic only. And so we can't really do much about it lifestyle-wise. We can't change it after the fact, but we can do a bunch of research to figure out what genes and what people might be susceptible. The problem with that is that's taking things out of your control. You can't really control who your parents are and who your genes and what your genes are. But it's obviously not just genetics that we can attribute to all the autism symptoms. There's a dramatic rise in autism symptoms and diagnosis in the last decade or so, or 20 years. And we haven't changed our genes, but we have changed the amount of toxins that we're exposed to through foods, through stress, through pesticides, through heavy metals. There are many different ways that we source toxins. So anything we can do to try to figure out what those toxins are and avoid them is going to help not only prevent autism in the future, but help reverse some of the symptoms that are already there. So one of the big things the easiest thing to control, in my opinion, is foods. There are foods that are inflammatory and foods that aren't inflammatory. Food is information. It makes all the chemical reactions happen in our body. So when you eat foods that might be inflammatory, that disrupts some chemical reactions. Foods in this patient population specifically that over and over again tend to be a problem are gluten and dairy. There are multiple reasons for that. Whether or not you have an allergy to it or not, there are multiple, again, biochemical reasons why you should avoid gluten and dairy. So if people are listening and they have children or grandchildren or family members or friends with autism symptoms, and you haven't tried to get off gluten and dairy 100%, that's the easiest thing to try, in my opinion. Also with foods, there are things like food dyes that are detrimental for things like hyperactivity, for brain inflammation, things like glutamate and MSG and different preservatives. So again, food is something you absolutely have control over. I know it's hard and everybody moans and groans about it and rolls their eyes, but it's absolutely in your control.
I think that's a really good point. And one of the things that we really try to highlight, and you may notice if you're on our website or you follow us on Facebook and you read what we're writing, we tend to follow a lot of the same themes over and over again. And as Jessica was mentioning before, that inflammation is one of those areas that we really have to focus on when we're dealing with a chronic disease. And again, it doesn't matter whether we're talking about autism or we're talking about any other chronic disease that we deal with in this country. The three areas that we focus on in our practice is trying to identify inflammation, helping people to detoxify because it's an inability to detoxify that drives chronic disease, and then deficiencies in vitamins and minerals. And actually, before we went live, there was a question that was asked about what's the real benefit to detoxification, and why do we have to focus on detoxification so heavily when we're talking about chronic disease. And I think that this is also a critical area of interest as it relates to patients with autism spectrum disorder. Because as the body holds on to toxins, toxins can be disruptors to the body's normal function. And so when we try to get somebody back to a higher state of health, by removing those toxins and helping the body to detoxify, we allow that chemistry that needs to occur to flow freely from point A all the way to point Z. But when we have disruptors like foods that we may be sensitive to, or metals, or organisms that shouldn't be in our microbiome, that thriving place in our gut where we have 100 trillion organisms that keeps us healthy and keeps our immune system healthy. If we have organisms that we call opportunistic, or let's go with bad organisms, it can disrupt that flow. And so when we focus on detoxification, and how do we do that? Real simple. We can sweat, whether it's sweating through exercise or using an infrared sauna or steam, taking an Epsom salt bath, drinking water, peeing and pooping are detoxifiers, eating cruciferous vegetables like your broccoli, cauliflower, Brussels sprouts. These are all wonderful ways that we help to remove those things the body doesn't need to hold on to, and then again allows us to function at a much higher level. So whether it's a patient with autism or a patient with any other chronic disease, it is critically important for all of us to be focusing on detoxification every single day.
Right. Along those lines, detoxification is probably, a common theme throughout every kid with autism. There's a saying that if you know one kid with autism, you know one kid with autism. But having said that, everyone's very individual, but they really do have a lot of similar themes. And one theme, like I already said, is gluten and dairy sensitivity, not converting the gluten and dairy to healthy substances, but rather opiate-like substances. Then another chronic theme is gut dysbiosis, or abnormal bacteria levels in the gut, and constipation. If you talk to any autism parent, find one that doesn't have some kind of GI issue. And when they're taken to the doctor, they might be told, oh, well, it's just the autism. Well, I don't really know what that means, but it's definitely a fixable issue. But most kids are constipated. And like Dan said, constipation is one of the main routes to get toxins out. Your liver, your gallbladder, all the bile, it attaches to the toxins, pushes it in your gut. And if you don't poop it out and it's just sitting there, it's all reabsorbed. And most of these kids have some kind of detoxification genetic susceptibilities usually, and we'll probably find out in the next decade more and more about those, but things like MTHFR, genetic difference, and then again, the constipation. So we already know the kids aren't detoxifying well. We all have a bucket where we can put all our toxins in. Everyone's bucket is a different size based on a large amount of genetics, but also the environment, for your past however many decades you've been alive. So when you fill the bucket up, and it starts overflowing, that's when symptoms happen. So anything you can do to start decreasing the amount of stuff in the bucket is going to help. And again, that's not about genetics, really. It's about your environment that you have a lot of control over. There are plenty of things that are very hard to control. The air quality outside, if you happen to live in a city, or the area we're in now. Can't always control the past exposures, the vaccinations you might have had with heavy metals, et cetera. You can't really control the amount of heavy metals and toxins that were passed on for mom and grandma, because those things stay in your body. But you can control the foods you eat, sourcing organic food without pesticides. There's so many other, environmental things. Oh, and the personal care products. You have control over what shampoos and soaps and laundry detergents your children are exposed to. And you clean your house, or you pay to have someone clean it, but either way, you can still control what chemicals you use in your house. You can control what pesticides are used on your lawn and inside your house. You can control what vitamins they take. Even the vitamins, you can buy a really crappy sugar-filled, dye-filled, chemical-filled vitamin, or you can source good quality supplements. What else can you control?
Well, I think, we could go on and on with that list, but I think, to make this so much more tangible, and why you're so hopeful in working with this patient population is because of your personal experience with your son Josh. And I think it's really important for you, as you've shared on the website, for you to even just spend a couple of minutes explaining, how were you able to recover a child at age 3 or 4 who was severe enough to be at the Cleveland Clinic School of Autism and going through behavioral therapy for a diagnosis of autism spectrum disorder? What can you offer as far as that hope to families who may be dealing with a child, a loved one, a friend who's been diagnosed with autism spectrum disorder?
Right. So again, that's why this subject is so important to me, and learning everything I can about it now is so important. That's what got me into this functional medicine field in the first place. So basically, my oldest son, Josh, was diagnosed with autism spectrum disorder around 3. We've been noticing symptoms for a while before that. I was a resident at the time, didn't have much time to go to his doctor's appointments or really research a whole lot. So I just accepted what was told to us. I was told that applied behavior analysis therapy was pretty much the only option, and that was the best. And it was super expensive. Thank goodness a family member allowed us to do that for 2 years full time. And that did help somewhat. It helped him get potty trained. It helped him start using a couple words. It helped him eat sitting down at the table rather than eating running all over the counters in the kitchen. He was still only eating pretty much macaroni and cheese and chicken nuggets and french fries, again, which you have total control over. There's no 3-year-old in the world that controls their diet, no matter how much kicking and screaming and fussing they do about it. You control that. So then time went by. He ended up being on probably about 6 different ADHD medicines. They wouldn't let him in school unless he took his medicine. We got multiple phone calls all the time that we forgot his medicine. Can we please come pick him up? The medicine started making him very irritable. He would get home from school and the dog would look at him the wrong way and he'd flip out. And he didn't sleep because of his medicine. He didn't have much of an appetite. He just wasn't a happy kid. And so that just made me realize there must be some other way. So I started listening to a podcast here and there. And again, working full time as an OBGYN, I didn't think I had a whole lot of time to really delve into this. But then I kept stumbling upon different things over and over again and realized there's a whole world out there of biomedical autism treatment. And so what I did with my son was very piecemeal. It wasn't in an organized fashion by any means at all. In his case, he was very constipated. He had large amounts of candida, which is a yeast in his gut, which we still have to deal with every now and again, flaring up and treating it. Once we treated the yeast, once we got his minerals and nutrition back in balance, he had a pretty severe mineral imbalance, probably from what was happening with his adrenals for so many years. And then he had a genetic predisposition to celiac disease as well. So we got out gluten 100%. And those things made the most difference in his case. We did a lot of tests. We did hair analysis. We found aluminum. We never actually chelated him. But again, we replaced his minerals and made his nutrition optimal. So his body kind of healed itself. And now he's an awesome 17-year-old. I want to say probably has the best grades out of any of my kids. He's not in any special classes. He does his homework without fussing all the time. Matter of fact, I don't think he's ever asked us for help with his homework.
And he's an amazing guitarist, and bassist too. And I've just been introduced to him in the last several years, and so not having seen him when he was originally diagnosed, and to see him now as a typical thriving teenager, and I thought it was really funny when you asked his permission to talk about this today. What he said was, quote,
right. He said, "Well, I don't have to do anything, do I?"
Well, that's a teenager for you, right? Spot on. So I think that's a great story. And again, I think the opportunities are there for parents and for patients who are dealing with this diagnosis, that there are things that are modifiable, and we are certainly here to help any way that we can. And so we just want to make sure that you as an audience recognize, whether it's autism or any other chronic disease, if you're looking to achieve that higher quality of life, then I think we are here to really help you on that journey.
Right. And there's a whole lot you can do at home without a doctor too. I mean, again, the foods, getting out gluten and dairy, getting on a good multi-mineral, multivitamin, getting enough fatty acids, whether it's fish oil, cod liver oil, or actually through foods, getting all of the crap out of your house, living in a totally clean environment for your kid. And then, really decreasing the sugar so the gut bacteria is in better balance. But then there are things also that you might need help with doctors or from doctors, like figuring out if there's a heavy metal toxic burden, figuring out if there are parasites or yeast overgrowth or any kind of bacterial overgrowth in the small intestine. There can be folate deficiencies, which is a really important B vitamin in your brain specifically. There can be adrenal problems. There can be hormonal problems. But again, detoxification, poor nutrition, constipation, that's probably a theme through all of them. And again, there's a lot you can do, so start doing it now. And in the meantime, try to find a provider that understands the biomedical interventions, and you can make progress. There's absolutely no one with autism, and I hardly ever say all or nothing, but that won't be helped in some way by biomedical intervention. Who knows how much it'll help, but even if it helps 10%, but what if it helps 90? What if it helps 100? So, I mean, there's no reason not to try.
Well, I think that's great messaging, and really, really appreciate you, the audience, taking time today to listen to us. We love you guys. We're here for you. Anything that we can do to help, please, please, please reach out. And as Jessica said, we want to continue to do Facebook Live, and so we will plan on it. And we would really appreciate you writing in and letting us know topics that you would like to hear discussed. We want to be mindful of your time. And so we just want to, again, say thank you very much for tuning in and participating today. Look forward to doing this again. And you guys have a great, great rest of the week. And we're always here to help you. Remember that when you're on your journey for inspiration, look at us at Inspire Wellness. We're here to help you on that path to the highest quality of life.
Before you look to us, though, look into yourselves, because again, I can't stress the importance that as parents, you have so much control over your child's environment. So don't forget about that too. Start now. Don't start in a week. Don't start Monday. Don't start January 1st. Start the very next meal.
Awesome. Thank you so much.
Thanks.
You guys
Bye.
have a great day. Bye.